Hello guys. Let's begin with the MCQs. The first one is patient is evaluated for dizziness and visual disturbance was found to have a downwitting nystagmus. A brain lesion was suspected and the patient was referred for an MRI. So what is the most likely site of the lesion? So I'll repeat the question. First it's a patient who is evaluated for dizziness and visual disturbances was found, and the patient was having a downwitting nystagmus and the brain lesion was suspected and this patient was referred for an MRI. So what is the most likely site of the lesion you have to tell? So it's anatomy question, if you know you can tell. Okay, the options are paracella region and the optic chiasma. Second one is the pineal region and the dorsal midbrain, and third is cervicomedullary junction, and the fourth one is posterior cerebral hemisphere. So basically you have to tell what is the condition in which you see a downwitting nystagmus, not the condition in which area of the brain you will see a downwitting nystagmus. So I'll repeat, it's a paracella region and the optic chiasma, pineal region and the dorsal midbrain, cervicomedullary junction, or it's a posterior cerebral hemisphere. So I think if you know the answer you can tell, otherwise I will only tell. So the answer is C, that is the cervicomedullary junction is the right answer. So basically what it was, downwitting nystagmus. So downwitting nystagmus is basically you have to tell the patient to look below base, not tell the patient to look above or below. So it will move up and down. Basically up and down motion of the eyeball will be a downwitting nystagmus. So it will be seen in cervicomedullary junction. You have to remember all that. So we have what I have given is, it's a cervicomedullary junction. Example, Arnold Chiari syndrome, or it's a syringobulbia, or is a manifestation of cerebral degeneration. And what are the drugs which can cause this? It's phenytoin, lithium, barbiturates, carbamazepine, and we have other diseases like one it's encephalopathy and demyelinating disorders will cause downwitting nystagmus. So next question we have, the rod receptor potential differs from other surface receptor in that it shows, options are depolarization, decreased negativity, increased conductance of sodium, and hyperpolarization. Basically they are asking if there is a rod receptor, so what will happen in case of rods, that is in the eyes. So it will be depolarization, decreased negativity, increased conductance of sodium, so it's a hyperpolarization. So how will it differ from the surface receptor? Surface receptor are the skin receptors. So if you can try this. How is the rod receptor different from the surface receptor? Options are depolarization, decreased negativity, increased conductance of sodium, and hyperpolarization. Anyone can try if you want. Okay, okay, I will tell the answer. It's D, hyperpolarization. Basically in rod receptors we are seen in the eyes. So it will have hyperpolarization, that is if there is a light stimulus. So what will happen if there is a light stimulus, the sodium channels will be blocked. And whereas in normal, if you have skin and any receptors in the skin, what will happen? It's basically ion channels will open and it will call depolarization. But in case of rod, it will be like hyperpolarization will be there. So you have to remember this. So it's a rod receptor hyperpolarization, or as in normal skin receptor it's a depolarization. So next we have a patient presents with you with a history of having ingested one of the seeds shown in the image below. Which of the following is not true? So it's an image. Okay, I will tell what is a seed. It's a seed of Stringonus nuts vomica. I don't know that what is it. A patient presents to you with the history of having ingested one of the following seeds, and the seed is a Stringonus nuts vomica. So which of the following is not true? First, it acts by blocking the action of GABA in the spinal cord. Second, ingestion of one of the crust seeds causes fatality, and third is death is associated with post-mortem caloricity, and fourth is mind remains clear till death. So basically it's a seed that you have ingested a seed, and the seed is Stringonus nuts vomica. It's a forensic question. If you know about this seed, then only you can tell. It's a seed of, I will repeat, it's a Stringonus nuts vomica, and which of the following is true? So it's options are, it acts by blocking the action of GABA in the spinal cord. Then we have ingestion of one of the crust seed causes fatality. Third is that is associated with post-mortem caloricity, and the fourth is your mind will remain clear till death. Basically, if you know about the seed, then only you can tell. So the answer only I will tell. It's, I think most of I also didn't know the answer. So yeah, the answer is it acts by blocking the action of GABA in the spinal cord. So basically stretching, that is the seed, is a competitive antagonist of glycine at the postsynaptic receptors in the motor neurons of the anterior horn of the spinal cord, which will lead to increased activity in the motor neurons. So yeah, it's basically stretching poisoning they are talking about, and the fatal dose is 15 to 30 mg, and that is one seed. Yeah, so whatever it is, the answer is it acts by blocking the action of GABA in the spinal cord, and others are not the right answer. If you want, let's see, it's directly associated with postmortem callosity is not. No. Okay. Next we have voice not clear. Am I audible? Okay, I'll tell. Next question we have: a woman with gestational diabetes is admitted to the labor room. The delivery of the baby's shoulder is delayed after the delivery of the head. So when is the shoulder dystocia considered? And options are: head to shoulder delivery time greater than 30 seconds, head to shoulder delivery time greater than 45 seconds, head to shoulder delivery time greater than 60, or it's greater than 120 seconds. Both spreading. Okay, I will slow down. It's a woman with gestational diabetes mellitus and is admitted to the labor room. The delivery of the baby's shoulder is delayed after the delivery of the head. When is the shoulder dystocia considered? Basically, you have to tell when is the shoulder dystocia, what condition it will be there. It's like head to shoulder delivery is greater than 30, 45, 60 or 120 seconds. So I will repeat if you are not with speed. See, it's a woman with gestational diabetes mellitus is admitted to the labor room. The delivery of the baby's shoulder is delayed after the delivery of the head. So when is the shoulder dystocia considered? Greater than 30, greater than 40, greater than 60 or greater than 120 seconds. So basically I will tell the answer. It's the answer here is that is C. If it's a head to shoulder delivery time is greater than 60 seconds, you consider it as a shoulder dystocia. That's all. Not all that is okay. What are they are given as a risk factor for shoulder dystocia is like diabetes mellitus, obesity, postdatism and prior history, and excessive weight gain during pregnancy. So yeah, I think it's audible or its sound is okay. So yeah, shoulder dystocia will be when there is head to shoulder delivery time greater than 60 seconds. Next we have a patient who was brought to the emergency department. Can you... Okay. Next question we have: a patient was brought to the emergency department with an injury to the neck following a RTA. On examination, she was found to have decreased sensations over the back of the scalp. Which nerve root has likely been injured in this patient? C2, C3, C4 or C5? So you can, who is there? It's Meenakshi. You can contact with DM. So yeah, next question was: a patient was brought to the emergency room and with an injury to the neck following an RTA. On examination, she was found to have decreased sensation over the back of the scalp. So which nerve root is likely to be injured? C2, C3, C4 or C5? So yeah, you can try this. Other than just asking for all that, you can try the questions. So which nerve root will be likely injured in this? There is a decreased sensation in the back, that is over the back of the scalp. So yeah, like here it is basically back of the scalp is here. Okay, I'll tell it's C2. C2 is the right answer. So C2 nerve root is basically injured in the for a decreased sensation over the back of the scalp. So yeah, C2 is back of the scalp, C3 is anterior aspect of the neck, C4 is lateral aspect of the neck, and C5 is deltoid muscle. So you have to remember all that nerve roots. Next question we have: it's a HIV positive patient with which presents to you with a headache and knuckle stiffness. The CD4 count is 90 and CSF sample with India in staining shows the presence of encapsulated yeast cells. So which of the following is the treatment of choice for this patient? It's fluconazole, amphotericin B, flucytosine or amphotericin B plus flucytosine. I will repeat, it's an HIV patient with headache and nuchal rigidity, nuchal stiffness, and CD4 count is 90. CSF sample with India ink staining shows presence of encapsulated yeast cells. So which of the following is treatment of choice for this? First you have to tell what kind of diagnosis, otherwise you won't know. And I will tell the options once: fluconazole, amphotericin B, flucytosine or amphotericin B plus flucytosine. So yeah, if you can tell the total diagnosis, it's HIV, headache, nuchal stiffness, CD4 90, CSF sample with India ink staining shows the presence of encapsulated yeast cells. Okay, I will only tell it's the answer here is leave the answer. I will tell diagnosis. It's basically a case of meningitis, because whenever you have an headache, see with fever also, if it is fever, headache and nuchal rigidity, you think of meningitis. So yeah, it's meningitis is the right answer. It's a diagnosis basically. So yeah, it's if you have a CSF with India ink staining and it shows encapsulated yeast cells, it's a cryptococcal meningitis. So cryptococcal meningitis is the diagnosis here. And what is the treatment of, that is the drug of choice for this? It's amphotericin B plus flucytosine. It's the treatment of choice for cryptococcal meningitis. Oral fluconazole is also there, but is used for consolidation and maintenance therapy after 2 weeks of induction therapy with amphotericin B. So yeah, the answer is amphotericin B plus flucytosine. Next question we have, which of the following is the most common malignant tumor of the nasal cavity? I think you can try this at least. Which of the following is the most common malignant tumor of the nasal cavity? And the options are squamous cell carcinoma, basal cell carcinoma, malignant melanoma, or neuroblastoma. So yeah, at least anyone try this. Most common malignant tumor of nasal cavity: squamous cell, basal cell, malignant melanoma, or neuroblastoma. So anyone can tell this answer. It's most common malignant tumor of nasal cavity. Okay, yeah, the answer is, that is the A is the right answer. That is the squamous cell carcinoma is the most common malignant tumor of nasal cavity. That is about 80% of the cases we see that. Next we have, which is the most common inflammatory myopathy seen in the elderly? Polymyositis, dermatomyositis, inclusion body myositis, or it's myositis secondary to overlap syndrome. So yeah, I will repeat, it's what is the most common inflammatory myopathy seen in the elderly? It's polymyositis, dermatomyositis, inclusion body myositis, or myositis secondary to overlap syndrome. So yeah, anyone can at least guess this answer. Most common inflammatory myopathy seen in elderly. Carcinoma, which carcinoma? Carcinoma is not in the option only. So yeah, the answer here is, that is C. That is the inclusion body myositis is the most common inflammatory myopathy. Myopathy is basically, it's any related to muscle basically. It's inflammatory myopathy in elderly. So yeah, greater than 50 years. It is characterized by progressive asymmetric muscle weakness. Most commonly involves the wrist, finger, flexors, and quadriceps. So yeah, carcinoma is not there. It's basically, it's including body myositis is the most common inflammatory myopathy of the elderly. Next we have Wallenberg syndrome is most commonly caused by thrombosis of which of the following arteries? So the options are previous answer. Okay, I don't remember the question only. Yeah. So we have Wallenberg syndrome is the most commonly caused by thrombosis of which of the following arteries? And the options are vertebral artery, posterior inferior cerebellar artery, anterior inferior cerebellar artery, or basilar artery. So if you know, you can tell, otherwise and no one will. Yeah, I will repeat, it's a Wallenberg syndrome is most commonly caused by thrombosis of which of the artery? Vertebral, posterior inferior cerebellar, or its anterior inferior cerebellar, or its basilar artery. What is Wallenberg syndrome? You can tell that. Okay, basically thrombosis of the vertebral artery is most commonly the answer only I told. Yeah, that is the answer, vertebral artery. That is basically thrombosis of the vertebral artery is known as the Wallenberg syndrome. So you have to remember it's anatomy or whatever you can say. Clinical question. It's a Wallenberg syndrome, basically thrombosis of vertebral artery. Wallenberg syndrome is also called as lateral medullary syndrome. Wallenberg syndrome, also known as lateral medullary syndrome, is due to the occlusion of the ipsilateral vertebral artery in most cases. And that's it. Again and again, same thing they are repeating. So yeah, next question we have, as per WHO staging of HIV, which of the following HIV positive patients cannot be classified? It's cannot be classified as stage 4. And the options are 29-year-old man diagnosed with cerebral toxoplasmosis. Second is 56-year-old woman with significant weight loss and muscle wasting. And third option is a 43-year-old lady being treated for pneumocystis pneumonia. And the fourth one is a 32-year-old man with oral candidiasis. So I repeat, it's as per the WHO staging of HIV, which of the following HIV patient cannot be classified as stage 4. So you know the staging of HIV, so you can try if you want. Basically, its options are only very big. Its options are 29-year-old man diagnosed with cerebral toxoplasmosis. Second one is a 56-year-old woman with significant weight loss and muscle wasting. Third is a 43-year-old lady being treated for pneumocystis pneumonia, and the fourth is a 32-year-old man with oral candidiasis. So which of the following HIV positive patient cannot be classified as stage 4? And the answer here is, it's D. That is 32-year-old man with oral candidiasis. Basically it's a stage 3 and not stage 4. And that's whatever they have given, it's a complication of HIV. And candidiasis also is there, but it's not that complicated. So staging is there. As you all know, it's from 1 to 4. The first stage is asymptomatic, and there will be a persistent lymphadenopathy, generalized lymphadenopathy, and stage 2 mild symptoms. Stage 3 and 4 represent advanced and severe illness respectively. So stage 3, it's a that candidiasis will be in stage 3, others will be in stage 4, because the complication is not that much in case of candidiasis. Next we have trauma and injury severity score includes which of the following components? GCS, I will repeat, it's a trauma and injury severity score includes which of the following components? Options are GCS plus BP plus RR, respiratory rate, then RTS plus ISS plus H, and third option is RTS plus ISS plus GCS, and the fourth is RTS plus GCS plus BP. So if you know what is what is trauma and injury severity score. Revised RTS is basically revised trauma score. BP that is blood pressure, RR is respiratory rate, and ISS is basically injury severity score. So if you can. So what is trauma and injury severity scores? Okay, the answer is B. That is trauma and injury severity scores includes what? RTS, that is the revised trauma score, plus ISS, that is the injury severity score, plus age. So you have to remember all the staging. Basically, Glasgow score, we all know it's from 3 to 15, eye opening, verbal and motor response. But revised trauma score is Glasgow score plus respiratory rate plus BP. So you have to know all that. What is injury severity score? What is Mangled extremity severity score? What is trauma injury severity score? So next we have which of the following is true regarding Oncotype DX, a molecular test used for breast cancer. And the options are, it is used for hormone receptor negative cancer. It's a 21 gene assay. And the third option is, it's helpful in predicting the advantage of adding radiotherapy. And the fourth is used for lymph node positive cancers. So you have to know basically what is Oncotype DX. It's a molecular test for breast cancer. So its options are used for hormone receptor negative cancer. It's a 21 gene assay, helpful in predicting the advantage of adding radiotherapy, and used for lymph node positive cancer. So Oncotype DX assay is for what? Anyone? Okay, the answer is B, right? It's a 21 gene assay. So Oncotype DX is basically for breast cancer, and it is a 21 gene assay. and higher score parent high increased benefit from chemotherapy, and lower score will be that prognosis basically in this. So yeah, next question. It's a 35-year-old woman presents with progressive weakness and fatigue. Her hemogram is given below. So what is the best investigation to arrive to a diagnosis? So your hemoglobin is 6, RBC is 4 million, WBC is 1000 and platelet is 6500. So I repeat, it's a 35-year-old woman. She comes to you with progressive weakness and fatigue. And whatever I told, that is hemoglobin 6, RBC 4 million, WBC 1000 and platelet is 6500. So what is the best investigation to arrive at diagnosis? So basically you are to think what is the provisional diagnosis for this condition. And the options are bone marrow aspiration, bone marrow biopsy, HB electrophoresis and flow cytometry. So basically if you can tell what is the diagnosis, you can tell a diagnosis from the hemogram only, that is HB sits. HB sits, that is it is low, RBC is 4 million, it's also low, WBC is 1000, it's also low, platelet is 6500. So basically it's a case of pancytopenia. So in the case of pancytopenia, what to consider? So the question is very simple. The question is what is the best and that is the investigation of choice for pancytopenia. And the options are bone marrow aspiration, bone marrow biopsy, HB electrophoresis or flow cytometry. So yeah, if you can answer this, it's an easy one. Pancytopenia, investigation of choice. Anyone? Causes, so you know, yeah, but yeah, anyone? Investigation of choice. Okay, the investigation of choice, it's biopsy. Yeah, it's a bone marrow biopsy is the right answer. It's for the investigation of choice for pancytopenia. And yeah, causes, you know, it can be aplastic anemia or myeloid neoplasms can be the cause for this. Okay, next question we have. Calculate the therapeutic index of a drug whose dose response curve are plotted below. So this is the image, so I cannot tell. Yeah, most common cause. The question. The most common is that only, aplastic anemia. It's aplastic anemia is the most common cause for this. Or myeloid neoplasm also there, but it's most common is aplastic anemia. And next one, yeah, next question we have. Which of the following is not a feature of Amsel's criteria? So you have to know what is Amsel's criteria, then only you can tell. So yeah, if anyone can tell what is Amsel's criteria. Basically, Amsel's criteria is used for vaginal, that is bacterial vaginosis. So you have to tell the options. So which of the following is not a feature of Amsel's criteria? And the options are homogeneous thin raised discharge, vaginal pH less than 4.5, amine odor after adding 10% KOH, or its epithelial cells started with coccobacilli. Yeah, bacterial vaginosis. So the question is, which of the following is not a feature of Amsel's criteria? So homogeneous thin raised discharge, vaginal pH less than 4.5, amine odor after adding 10% KOH, or its epithelial cells started with coccobacilli. Yeah, B is the right answer. Vaginal pH, it will be less than 4.5%. Because acidic feature is not a pH. Basically, bacterial vaginosis, it will be there when it's opportunistic. Basically, yeah, partner treatment is not required. Yeah, right. Basically, normally, what I know is it's an opportunistic infection, and basically the pH is due to lactobacillus and all that. So yeah, basically if it's a bacterial vaginosis, the pH will be greater than 4.5 because it's acidic. Normally it's acidic only. So yeah, we tell the Amsel criteria. It's homogeneous, whatever. It's not a feature. Rest all is there. See, homogeneous thin raised white discharge. pH will be acidic. pH will be what? Okay, pH will be greater than 4.5. That is, it will be not acidic. Normally it is acidic, I told. And it's a positive with amine test, that is the feces odor when drop of 10% KOH is added to vaginal discharge, and it's due to excessive cleaning of vagina. Okay. And loose cells on saline wet mount, vaginal epithelial cells started with adherent coccobacilli at the C. Yeah, that's what. Basically, what I told was what they have given is severity caused by reduction in lactobacilli, because lactobacilli will cause lactobacilli will get reduced, because acidic pH is caused by lactobacilli. If it is decreased, it will increase the pH. So yeah, that. and an increase in anaerobic organisms like Gardnerella vaginalis, Mycoplasma hominis, and Preventalo species. So yeah, you were right, it's that only. Next we have, in order to provide high quality CPR, what should be the rate of chest compression per minute? That's an emergency medicine question. So the options are 60 to 80, 80 to 100, 100 to 120, or it's 120 to 140. I repeat, in order to provide a high quality CPR, what should be the differential? Okay, what should be the rate of chest compression per minute? 60 to 80, 80 to 100, 100 to 120, or 120 to 140. So yeah, differential diagnosis is, yeah, C is the right answer. 100 to 120 normal what you do chest compressions. It should be 5 to 6 centimeter in depth and 100 to 120 per minute. And whatever it is, allow for complete chest recoil. Minimize the interruption in compression at less than 10 seconds. And you have to attempt to for CPR quality if PtCO2 is less than 10. Yeah, that's it. Yeah, it's it's a differential diagnosis of vaginal discharge. And yeah, it's a higher topic. So next question, we have a chronic smoker is there who has recently diagnosed with COPD, finally decided to quit smoking. So he often thinks about stopping it, but it's reluctant due to the fear that he might become too irritable and restless without it. So which of the following options best describe the stage? It's pre-contemplation, contemplation, preparation, or it's consolidation. So basically it's a chronic smoker, he has COPD and he wants to quit smoking, but he thinks that if he quits smoking it will be very irritable for him. So irritable and restless. So which of the following options will best describe the stage? Pre-contemplation, contemplation, preparation, or consolidation. So yeah. Okay, the answer here is B, that is contemplation, because he thinks before leaving cigarette or before smoking, he thinks that it will be irritable and it will be very restless for him. So yeah, because he is basically, it's a contemplation. So what they have given is, patient is aware that he has a problem and he is thinking about changing his behavior. He is weighing both pros and cons of the behavior modification. That this is the characteristic feature of contemplation. So yeah, additional attitude and recovery usually involve pre-contemplation, contemplation, preparation, action, and maintenance. Next we have a child presents with left to right shunt and high output cardiac failure. The following is MRA. What is the diagnosis? Basically it's a image they have given. So I'll repeat once again. It's a child who has a left to right shunt. Child who has a left to right shunt and he has a high cardiac output failure. So following is the MRA. What is the diagnosis? So basically I cannot show you the image. It's a MRA, but yeah, I can tell just what is it. It's a vein of Gallen malformation. So if you know what is vein of Gallen malformation, you can think what will be the image in the MRA. So vein of Gallen aneurysm malformation, also known as median proencephalic AV fistula. It's an uncommon intracranial anomalies that tend to present in early childhood with features of left to right shunt and high output cardiac failure. So yeah, you have to know what is a vein of Gallen malformation. I also don't know that much. Next question we have, a patient comes to you with leprosy and he has completed a course of multi-drug therapy and he presents with complaints of developing painful, tender, raised lesions on his forehead, recently as shown in the image below. So what is the first line treatment for him? So I will repeat, it's a case of leprosy and he has completed a course of MDT and he presents with you with complaints of development, painful, tender and raised lesions on his forehead. So what is the first line now? What will you do actually? It's options are restart multi-drug therapy and start thalidomide. Then second is restart multi-drug therapy and start prednisolone, and start on clofazimine or start on prednisolone. That is prednisolone, yeah. Anyone? Basically he has a leprosy and he already taken MDT, has been taken, and he comes with painful, tender, raised lesions on his forehead. So think of something what it can be. Basically whenever what I have seen is whenever leprosy MCQ terms come, they are like for lepra only. they give same thing only, that is for ENL, that is here also it's that only ENL, that is erythema nodosum leprosum, and the first line of treatment for ENL is prednisolone. So mostly it's a lepra reaction what they give for MCQs. For the presence of new erythematous and tender subcutaneous nodules in a patient with leprosy indicates it's a lepra 2 reaction, and the choice for lepra 2, that is it's prednisolone. Next we have a child was brought to the emergency department with a big lesion on his forearm. As a surgery resident to decide to excise the lesion in the emergency operation theatre. So which of the following investigation will test the entire coagulation pathway? So basically you have to tell, the last one only, which of the following investigation will be the test will test the entire coagulation pathway, and the options are activated PT, thromboelastography or bleeding time. So this way at least you can try which of the following investigation will test the entire coagulation pathway: APTT, PT, thromboelastography or bleeding time. Okay, the answer is C, that is thromboelastography is the right answer. You have to remember this. The thromboelastography, it's basically detects the entire coagulation pathway. It measures coagulation, cascade, platelet function and fibrinolysis. So basically it's a test that quantitatively measures the ability of the whole blood to form a clot. So you have to remember this is thromboelastography, which can detect the entire coagulation pathway. Next question we have, enzyme with highest catalytic efficiency is. Options are Km of the enzyme equals to 10 micromole and Kcat is 20 per second. Then Km is 2000, Kcat is 50, Km is 2, Kcat is 200 and Km is 4 and Kcat is 200. So so basically you have to remember this. It's an enzyme with highest catalytic efficiency is Km of an enzyme is 2 micromole and 200 per second. It's higher values of Kcat and lower values of Km give better catalytic activity. So here higher is 2 and 200. Higher values is 200 and Km is 2. Okay. Next we have a 14-year-old girl is feeling embarrassed as she has to often rush to the restroom during school hours. Her friends also make fun of her as she blushes frequently for no reason. She was later diagnosed to have an appendicular tumor. So labs revealed low levels of niacin, with tumor being positive for synaptophysin. So which of the following biochemical mighties can be demonstrated in this patient urine sample? So it's 5-hydroxyalkyl acetate acid, vanillyl mandelic acid or ACTH or catecholamines. So I repeat, it's a 14-year-old and she rushes to the restroom during the school hours. She blushes frequently with no reason. Appendicular tumor is there and her labs has low niacin level, tumor positive for synaptophysin. So what is the following biochemical demonstrated in the patient urine sample? So it's 5-hydroxyindole acetic acid, vanillyl VMA, ACTH or catecholamines. So the answer is A, that is 5-hydroxyindole acetic acid is the right answer. The elevated can be seen in this condition. So it's a carcinoid tumors. Basically it's talking about carcinoid tumors of the endocrine tumors. It's arise from the enterochromaffin cells that can occur anywhere in the GIT. Basically in children they are most commonly in the appendix, and the tumor elaborates serotonin 5-HT and histamine, which produces flushing, watery diarrhea and bronchoconstriction and right heart failure. So basically it's a case of carcinoid tumor and children it is appendix. That's why it will cause all this. It's a neuroendocrine tumor and it will release serotonin 5-HT, histamine, which will cause flushing, watery diarrhea and bronchoconstriction and the right heart failure. So diagnosis will be confirmed by urinary 5-HIH, hydroxyindole acetic acid. So it's a carcinoid syndrome and it can cause secondary niacin deficiency as a consumed. Whatever it's a carcinoid tumor, it can cause niacin deficiency. You have to remember that. Next question we have, a 24-year-old female presents with complaints of vaginal discharge and pruritus. A pap smear was given as given below. What is the causative organism? So it's a vaginal discharge and pruritus. Basically I will tell what is there in the pap smear. It's clue cells. We discussed recently only. What we discuss is clue cells. So clue cells are present in what? See, there is a pap smear, and in that pap smear you see, basically you find clue cells, and the patient complains of vaginal discharge and pruritus. So basically the diagnosis goes towards what? It goes towards bacterial vaginosis. And yeah, the organism will be Gardnerella, because options are Trichomonas, Gardnerella, Candida, Lactobacillus. So yeah, its option is Gardnerella is the right answer for clue cells. It's a high yield topic, and cells criteria about that. And treatment is oral metronidazole 500 mg BD for 7 days. Alternatively, ampicillin and cephalosporin can be given. So yeah, metronidazole 500 mg for this. So next question we have, it's a 20-year-old unimmunized patient presents to you with complaints of weakness over the lower limbs. So it's having inability to pass urine and fever for 3 days. So his stool samples were sent to the district lab to confirm a diagnosis. So which region of the spinal cord will primarily be affected in this condition? I will repeat, it's a 20-year-old unimmunized patient, complaints of lower limb weakness, inability to pass urine, fever for 3 days. So his stool samples were sent to confirm a diagnosis. So which region of spinal cord will primarily be affected here? And the options are anterior horn cells, posterior horn cells, lateral horn cells, and it's an intermediate column. So yeah, I repeat, it's a 20-year-old unimmunized patient presents to you with complaints of weakness of the lower limb, inability to pass urine, fever for 3 days, a stool sample sent for diagnosis, and which region of the spinal cord will primarily be seen in this condition? Anterior horn cells, posterior, lateral, or it's an intermediate column. So yeah, the answer is, anyone? Okay, the answer is anterior horn cells. So yeah, and basically it's talking about polio, because in polio we see all the conditions, that is, it's an unimmunized weakness of lower limb, inability to pass urine, and fever. So it's a case of, it's a case of polio, that is paralytic polio we see, and anterior horn cells is basically most commonly seen in case of polio. So yeah, anterior horn cells of the spinal cord are primarily affected, causing acute flaccid paralysis. And the earliest change is the degeneration of the nasal bodies in the brain, what you see. So yeah, it's anterior horn cells. The last question for today, it's a patient presents to you with ptosis, meiosis, and anhydrosis. So which of the following structure mark is the most likely to be damaged? Basically they have given like a structure on which side, I cannot show you the image. If you see, think about ptosis, meiosis, and anhydrosis. Name the condition at least, because I cannot show you the image. Just tell me what is, it's a very simple question, just tell me what is the diagnosis if the patient has ptosis, meiosis, and anhydrosis. This I think you can tell diagnosis for ptosis, meiosis, and anhydrosis. Anyone? Okay, the diagnosis here, it's easy I think. Yeah, okay, I'll tell. The diagnosis here is Horner syndrome, because Horner syndrome is the triad of all three, that is ptosis, anhydrosis, and it was meiosis. And in this it was like the damaged part will be the cervical sympathetic trunk, which they have marked in the image, which I cannot show you. But yeah, it's a Horner syndrome, and it is caused by the damage to the cervical sympathetic trunk. So yeah, it's finishes for 20. So it's over for now. Yeah, thank you so much.